Hello, everybody. Welcome to womenlines.com. Yes, friends, today is a health segment show. The term period often comes with a sense of inconvenience, but for millions, it's a reality that disrupts daily life. Heavy menstrual bleeding, HMB, can be isolating and affect everything from work to relationships. There are so many women across the world whose life quality is impacted because of HMB. And beyond physical discomfort, HMB can also cause emotional distress too. I take pleasure to welcome Dr. Talat Uppal, gynecologist from Sydney, Australia, help us understand the causes and available treatments for HMB. Welcome, Dr. Talat, to our show.
Thank you, Charu. It's such a pleasure to be with you today.
Thank you so much for your time, Dr. Talat. Could you please explain what HMB, heavy menstrual bleeding, is and how it differs from a normal menstrual cycle?
Thank you, Charu. That's an excellent question. So, heavy menstrual bleeding is when the menstrual loss is excessive and it starts to impact the patient or the woman. So, the impact, like you rightly said, can be physical, can be emotional, can be social. So if someone can't go out to a social function or it's impacting their social context,
Right.
or material. So we all know how many girls take time off school or work. So it can be multifaceted in terms of its impact. So if it is impacting women, the amount of bleeding that they're having, then that is defined as heavy bleeding. So a normal period is actually, it can be a little bit difficult to define because we know that even within the same woman, sometimes she might have different types of periods. And of course, there's a wide variation between different women. But in general, we say that the bleeding should be ideally around 40 mils and it should be like 2 to 7 days duration. And it also should come around a normal period is 28 days, but the range is 21 to 35 days. So obviously we don't want it coming around too quickly because then, the woman's basically being disadvantaged on two fronts, that the flow is heavy and also the period is occurring very quickly. So, and also normal period should only be associated with mild pelvic cramps, not nasty pain. So heavy bleeding usually can be, it affects a quarter of women, Charu. So 1/4 of women of reproductive age report that they have heavy periods. And then half of them basically also have pelvic pain. So those are some background statistics about it. Imagine how common it is. Just let that sink in. 25% of women of reproductive age suffer from this medical condition.
Just want to understand, Dr. Talat, you said normal cycle goes around 7. Many
Yes,
women
up
might
to
not,
7.
up to 7. Many women might be not aware also, like, okay, how many days can be stretched to say that it is under HMB or it's like
Mhm.
a normal period. So
So,
rough number.
very, very good point. Thanks for that excellent point, Charu. That's why the actual definition is quality of life based. It's not obsessing with how much blood a person is losing because we're recognizing that some women might have less reserve. So, for example, someone might be already anemic, or someone might have dietary reasons that they are anemic. And so, a little bit of bleeding would then tip them into an impact where they're struggling, whereas other people might have more reserves. So if it is affecting their quality of life, if they're feeling tired, if they're not going to school or work, if they're not able to, I have women who tell me they can't go to a social function because they're worried they're going to flood through. So many facets. If it's affecting your quality of life, it is heavy periods.
So take a note, friends. You have to see what's happening around, what other ladies around your network are facing, and are you having the same experience or are you having something which is odd? We are not putting some number for days. It is all about how much it is impacting your quality of life, and that shouldn't be taken as a regular normal thing. So if these symptoms are happening, you have to go to your gynecologist. So,
Yes.
Dr. Talat, what are the common causes of HMB and how can we identify it?
So Half of the time, Charu, when we look for a cause with various means, we actually don't identify one. And this is so important to appreciate that even if you don't have a cause, it is a genuine medical condition because the amount of bleeding is excessive. Now, we did say that we've moved away from quantifying. Traditionally, Charu, we used to say anything above 80 mils is a heavy period, but we've moved away from that because we want to make it a concept that's easy for women at home to understand.
Yes, because
And
80
yeah,
ml is something like quite technical, and
it's
for
very
a lay
technical.
woman, I don't think so. It will be easier for us to
Exactly.
monitor that.
That's true. There are certain clues or what I call red flags that point us towards the fact that the period might be heavy. So, like we said earlier, if it's lasting more than 7 days, if women are using two types of protection, so sometimes they're using a tampon and a pad, or if they're waking up at night to change their pad, or if they're having to change their sanitary protection more than 2 hourly. So
Oh,
that will point us towards that something is not quite right. This is a heavy loss. Sometimes women are passing clots, and particularly if the clots are bigger than 2 centimeters, those are, that can worry
red flag.
us that
Yeah, we have to
living
see.
heavy exactly. And a number of patients will tell me that they flood through different their garments, and so that is also a concern. And of course, if they're tired, they're exhausted, they're dizzy, they're feeling short of breath, these are symptoms of anemia which can result from the heavy menstrual bleeding. So these are the kind of red flags that one should think through and say, look, if I'm actually ticking any of these boxes where I'm using multiple protections or I'm passing clots, then it may be that I have heavy menstrual bleeding. I'm sorry, in response to your original question about causes, I
Yes,
did
why it
mention that half
happens.
of the time, yeah, half of the time we don't find a cause, and the other half of the time we have. So there's a international body of gynecology called FIGO, and what they have come up with is a sort of like an algorithm called palm coin. So basically, what they've done is they've divided the causes into two. One is structural, which is basically mostly at the level of the uterus. And so this could be, for example, a polyp. A
Okay.
polyp is like a little chandelier in the uterus. It's a fleshy growth. And that could be giving the heavy periods. Also, fibroids, Charu, these are quite common in women, but they can, especially if they're big or they're poking into the uterus, can increase the amount of bleeding that a woman might have. There's another condition, Charu, called adenomyosis. Adenomyosis is this pathology here,
Okay.
where the lining of the womb should be inside. When it is found in the
Mhm.
muscle is not meant to have that lining. So it then creates this little areas of scarring, and it basically the whole uterus gets bigger in size, and therefore one of the manifestations of adenomyosis can be heavy bleeding. And the other structural cause, which is not that common, but I mean, I diagnose it regularly because this is my niche interest, is cancer or pre-cancer. And this is another reason why it's so important to seek timely care, because we don't know whether there is any cause, whether there's a cause that is benign or structural or non-structural, or whether this person is harboring something that we should actually diagnose in a very timely way because of the actual pathology itself as well. So a pre-cancer or a cancer. So just to put some context, Charu, a cancer of the endometrium or the uterus is
Mhm.
about 1 in 44 women. And so it's not that common, but obviously it's more common in women who are bleeding heavily because they're symptomatic. And if we put some comparison, like breast cancer is 1 in 8 women, so obviously, in that context, it is less common. But like I said, I do diagnose cancer regularly in our practice. So these, Charu, are the structural causes when we're looking at the uterus itself. But we know that periods are not just the uterus. It is a much bigger concept than that. So other causes can be coagulation problems. And that means that, you are more likely to bleed, for example, if you go to the dentist, if you have a graze, this can be familial, and this is more common in adolescents. So it is important to think bigger picture as well. And the other issue that is associated, or cause that is associated with heavy bleeding, is ovulation and lack of ovulation. So ovulatory disturbances. So what that means is, for example, when we're starting, so when we adolescents, younger girls, and also women that are getting closer to menopause on both ends, that's why heavy bleeding, obviously it can happen anytime, Charu, but it's particularly clustered to the ends of reproductive life. And the reason for that is because those are times when either the ovaries are not regularly, they're not always regularly ovulating. And so you can have anovulatory cycles. And what happens is that then some of those cycles can be very heavy. And you would have heard of polycystic ovaries,
Correct.
ovarian syndrome.
Common.
That is another ovulatory
Correct.
disturbance. And so other causes of heavy bleeding, Charu, can be like some women they've had breast cancer and they've been given medications that actually can cause heavier bleeding. And
Okay.
of course, then so there are a series of causes, and that's why it's so important, not only because the cause will dictate some of the management. Because if someone has massive fibroids, these fibroids are really small, but sometimes they can be really big.
So
And
if
so
untreated.
that person's treatment would be different to someone where we've found no cause, the options that we would offer women.
Great share, Dr. Tala. To my understanding, women hardly prioritize their health. Slowly, because of media, women are looking forward yearly testing done and be mindful about their health status. I think this information is really very important and it should reach out to as many women. Don't take things lightly. If you are having such situation, you have to consider some treatment. Otherwise, it can lead to some other consequences. So, Dr. Talat,
Absolutely.
can you share some latest things which can be used for cure for HMB? Is there any cure or any other treatments available?
So basically, there are a number of options, of management options available for women. And I think this is why, Charu, I find this space so fulfilling, because I feel there's genuinely so much we can partner with the patient to support them to a better place. And that's why I feel that it is so important that women are empowered with the information so that they can choose the option that they feel is the best fit from the ones that we recommend. So basically, it's almost like a pyramid in my mind, Charu, of options available. There are up to 19 options available, but if I'll talk about the more commonly used ones, at the very basic level, if someone says, look, I don't want anything inserted, what tablets or what options do you have that are least invasive? So there is a tablet called tranexamic acid. Tranexamic acid is not hormonal, and it can be combined with an aspirin-like drug called mefenamic acid. So these two, in general, they work together and they can combat some of the bleeding related issues. But the next level up amongst medical managements, which we are not talking about going to theater or surgery, we're talking about medical management, is an intrauterine device. And I'm going to show you this from my
Sure.
um, models. So this is what it looks like. And what happens in this case is it's a small, about 3 centimeter device, and the central part of it does have hormones. So this can, Charu, function for women who need contraception. So that's an additional benefit. But the reason, obviously, I'm discussing it for the heavy bleeding, so
Correct.
that they can support. This is the best medical management option for women. So apart from this, there are oral contraceptive pills that can be taken, or progesterone basically is one of the hormones that we can give in a cyclical way. So there are lots of options that we can support women with. If we need to go to theater, then there are certain options, because if we've got the uterus in women, as we know, is between the bladder and the bowel. That's the uterus. And within the uterus, we can use different surgical options to get rid of the polyp that I spoke about, to remove any fibroid. Not all fibroids are removable, but if they are, that is something that we can do in theater. For women who, Charu, have either completed their fertility
Mhm.
or they don't want children, so they can consider something called endometrial ablation. What
Okay.
we do in ablation is that we burn the lining of the uterus. So
Okay.
this is not contraceptive, but this is a great option because it's minimally invasive.
Okay.
And for some women, Charu, where we're worried about, for example, some significant precancer or cancer, or the fibroids are really big, or we've tried the simple things and they don't work, then a hysterectomy is an option as well for women. So where we try to keep the hysterectomy as a last resort, and we try with simpler things first, or at least discuss the simpler options first for women to choose.
Great share, Dr. Talat. See, friends, we are having so many options, and it depends upon what age group you are, what you're looking for, and what can be best suitable for your body. So it's all about knowledge, and here we are having that knowledge. Knowledge is power. Use this knowledge and take a decision about yourself. If you are having this problem, please go to your gynecologist and get some treatment for yourself. So, Dr. Talat, can you share more insights? What other activities you are doing to raise awareness about HMB and any other insights you want to share with our audience?
Thank you, Charu. So basically, we have embarked on significant research, advocacy, and clinical education in this field. And it wasn't that I necessarily, was thinking, my earlier younger self was thinking that I'm going to open a charity, start a charity, or any of this.
Mhm,
This is actually, Charu, coming from indignance because
mhm,
when I'm seeing women who have been putting up with heavy periods, sometimes for 10 years, sometimes since I was a teenager, and at times they will say to me, since my second child, I'll say, oh, your child is now 7 years old. Yeah, I guess so. I've been putting up with it for 7 years. So I started thinking, look, how are we as a medical profession? We're not meeting the core needs of these women. And how is our community awareness, so basic that their menstrual understanding or what is deviation of abnormal from normal, that inertia to seek timely care. And of course, when I diagnose a cancer, it's always even though it's not common, it's always a space where I question, like, how much earlier could we have, at
right.
what point
Very
could we have
true.
supported these women? And because we've started Australia's first abnormal uterine bleeding hub, which means that we have a team caring for this specific problem. You walk through our doors, whether they're actual or virtual,
Mhm,
and we will do an ultrasound if needed. We will give do a biopsy if needed. We'll plan the surgery if needed. We will certainly support with iron replacement because one of the biggest issues that women face is iron deficiency, and so that then becomes another layer of misery because they're already facing the anxieties around the heavy period, managing the physical logistics of having a really heavy period. And then on top of that, they're iron deficient and tired and exhausted from that. So we are able to do all of those episodes of services under one roof. But the charity work that we've started is around advocacy.
okay.
And Charu, I wanted it to be a global because this is a public health issue. It is an international issue. It is not confined to a particular race or a particular or developing versus developed. It is actually a problem that affects women everywhere. And so what we did was that we thought a lot about what sort of name we call the campaign. And in the end, we settled for Bleed Better because, Charu, I didn't want a fixation on perfection because sometimes the option that we offer may not be the best fit in the long run. Women might say, oh, no, I prefer to try this. It's okay. We just want you to
Mhm,
bleed better. We want you to find the Goldilocks option for you.
correct.
And that may be a different one at different times of your life. And because many times women worry about the side effect of something or different anxieties that they might have. And I wanted the message to be that consider your baseline. Your baseline is generally quite, it can be optimized. So if we focus on that we want you to get better, we want you to bleed in a way that's safer, that's kinder, that allows you to enjoy the quality of life that you deserve. So that women can get that message we are hoping, and in a global context. So the bleed better, then the next thing that I was a bit indignant about, Charu, was that it didn't have a day. This affects a quarter of women everywhere, and it doesn't have an international day. And when I did some research, there were things that had a day that were three in 1,000 people, and they had a day. And some of them, as a doctor, I didn't even know what they are. I had to Google that and find out it was a gene that was, different sort of, which is not a competition. Every pathology is important, and every patient deserves good care. But it made me more and more worked up that, why doesn't this have a day? So then we thought, okay, fine. So we went through all the processes of how to set up a day. And in the meantime, we have rolled this out ourselves with the help of a lot of domestic support in terms of from so many educational institutions. If you go on to bleedbetter.org, I would particularly like to give a shout out to our College of Gynecologists in Australia. They were the first organization to leverage us and say, yep, it's a good idea. Anything that optimizes women's gynecological well-being and move them to a better space is a good thing. And so they supported us. Then a number of other wonderful organizations supported us locally. Because it's a charity, we were able to get some volunteers. So some of our volunteers that have worked on this project are really quite young. And I'm very proud of that because we had limited resources. So as the organization grows, and I hope we get some strategic funding, I hope it gets endorsed by WHO or by United Nations longer term. I hope that this will be a path to better care for women in a critical area and a very fixable area. Charu, this is another part that, it's not that hard to control the heavy periods for most women. Okay.
Wow.
So, but it's
I
just, so
really
that
love
is
your
what,
passion. I
yeah.
really
So
love
I
your
think,
passion, Dr. Talat. Oh,
so
yes,
all of these together, yeah,
yes,
were
please
the
do
reason.
reach out to as many people across. Thank you so much for your time, Dr. Talat. And
Thank you,
ladies,
Charu.
take your health in your hand. Health is wealth. Share this episode with as many women across the globe. And yes, thank you so much for sharing your knowledge, Dr. Talat. Take
Thank you,
care.
Charu. It's been wonderful.
Thank you.